will have noticed, okay, for the benefit of the recording now, welcome to Eklavya Foundation's monthly series, first Wednesday of the week, where we have a guest speaker speaking. My name is Rohan Gupta. I work with the Eklavya Foundation for Mental Health. I help facilitate the English self-help group. Joining us are many members from other self-help groups that Eklavya runs. We are pleased, extremely pleased, to invite you to a insightful session today. Because during our self-help groups, whether it's a Shubharti, a care seeker, or Shubhankar, who is a caregiver, oftentimes we end up Googling or checking out things on the internet. Some of us use ChatGPT or other versions of generative AI or Gen AI as it's known. And it can be extremely helpful or in sometimes extremely harmful. There are documented cases today where Gen AI has really been a problem for people who have, especially young people, who have been seeking solutions for their troubles. And that's why we decided to get somebody who's very young and clued into all of this. So it's my extreme pleasure to welcome Dr. Vikas. If you could turn on your camera, thank you. Dr. Vikas, who is based in Chennai. He is a psychiatrist, right? And we are going to cover a range of topics. What is the benefit of AI? What are the risks of AI? How do we verify what we are doing is correct or not? And what is most important is the human touch. How do we make sure, because this is a computer that we're talking to, how do we make sure that it understands us? Um, Dr. Vikas has a very good background. He's been recommended to us by one of our previous speakers. If some of you have joined us before, Dr. Suresh Kumar. He's a consultant psychiatrist and he's a multidisciplinary collaborator who is now continuing his medical education sessions and is in a new role. And Doctor, currently you're in Chennai, but I believe that you're also working in the United Kingdom, right?
I'm moving there. So,
So over to you. And again, one last housekeeping rule. We will have questions. Obviously, many of you will have questions. So one last housekeeping rule before I hand it over is please post your questions in the chat box. There we can monitor and we will get to that once doctor is done. Over to you, Dr. Vikas. Thank you so much.
thank you so much, Rohan and Manjari. And even before I start sharing the slides, I should really show my gratitude for this wonderful opportunity to interact with so many people who've chosen to join us on a weekday evening. So, thank you everybody for joining us today, and hopefully, we'll have a great, fun session today. Uh, in addition to the rules that Rohan had mentioned, I think as the presentation progresses, as I'm speaking, I'm going to ask you some questions, and I'd like you to just type in your answers in the chat box. Simple one-word answers. So keep your phones in hand. And if you're busy, that's fine. You don't
We
have to
can
do
be
that
hands
as
up,
well.
hands down, reactions, all
Yeah.
of that.
So let me see if I can share my screen, and then I think we can get started.
Hang on.
Yes. Can everybody see my
Somebody's
screen?
message that they can't hear. Can everybody else hear?
Yes, we can hear him.
Okay, so maybe Shailesh, you're having some problems. Okay, please go ahead, doc.
I think Sailesh's message was earlier. Now he can hear. And thank you, Rohan, for keeping your camera on. If anybody else wants to keep your camera on, that's cool as well. That's very helpful to me. So, and thank you for that wonderful introduction. The first thing I want to confirm is, hey, I'm human. I'm not a machine. So you can kind of trust me a little more than a machine. I'd also like to say that a big part of this presentation, the design and all of it was AI made. So it's not like humans trump AI. We need to use AI to make our life easier. Uh, as we start, I want people with a show of hands or messages or reactions to tell me how many of you already use AI. Let me see if I can open the messages. Cool. Any more other than
I am
Raj?
74-year-old and commerce student and I am using ChatGPT.
Wonderful.
You can think everybody is
Ji,
using.
please, for the sake of this talk, I would request you to stay on mute. Thank you. You can talk in chat, but you can react using the react heart button.
So wonderful. So we have some people who already use it, and I'm quite excited for Bajrangji that he's found it and he's enjoying it. We got that from the tone of his voice. But for those who haven't yet used it, I think we need to start with a small introduction to what it is, right? So let's say the first time humanity as such was exposed to information that wasn't theirs. The first time someone saw a book and they read it, which means they're gaining information that they haven't experienced. We learned to outsource our intelligence. Learned to put knowledge outside of our brains. And as that evolved, as technology evolved, we got Google, which was a game changer, search engines, which made information very quickly available. And once the social media layer got added on, information could be shared to anybody instantly, 24/7. But the more information we had, it did not translate to more intelligence, it only translated to more confusion. So AI is probably a big amalgamation, a huge library of information that can give us instant answers, but may not be as intelligent as we think it is. Now, Bajrangji mentioned ChatGPT, and I think that's the most popular one among the accessible AI tools that most people have. When you go into it and you speak to it, it feels like you're talking to a real person, and it can talk in many languages and many dialects in your own local dialect as well, and it's always available. And it really doesn't care if you ask it the same question 20,000 times. It sometimes comes up with the same answer, sometimes comes up with different answers. Now, before coming up to, hey, what is this chat thing doing? When I ask it a question, what is it doing? We might think that it is thinking, it might process information, come up with an intelligent answer. But what it's actually doing, it's learning to recognize, is my voice audible to everybody except Shampa?
Yeah, Doc, we can all hear you.
Oh, cool.
Shampa,
Thank you.
maybe you're having issues with your device. Please go ahead,
So
Doc.
coming back, uh, let's say there is this huge library which has unlimited amounts of information, and this library tries to predict what you're going to type in next and throws in something random based on the information it has, based on probability. So it looks like human intelligence, but it's not. It's a more simpler form of pattern prediction and statistics. Now, all of us have phones, and when we're typing out something, it kind of predicts the spelling or the next name. So AI is something like that. It just completes what you're typing and comes up with an answer and does not completely understand concept. It knows which words look good together and which don't. So AI can explain, summarize, suggest ideas, opinions, but it cannot understand exact context, and it cannot take any kind of responsibility for what you do with what it suggests. It can definitely Can you still hear me?
You're breaking up right now. Maybe there's a lag. Could you just go back to understand and context?
Okay, so I was saying you can hear me clearly now, right? Hello.
Yes, we can.
Cool. So I was saying this machine cannot understand the context of your life. It can understand words, but it cannot read emotion very well from the words. Now, if I'm not a primary English speaker, it will not pick up emotions from my words. It will not take responsibility for the answers that it gives. So let's say you ask it, when does the train leave? And it tells you 10:30. You cannot really go back and ask it why it was wrong. It just say, hey, I got it messed up. Maybe I will correct it next time. Because it does not have context or empathy or accountability, it cannot provide genuine care. Now, if you can remember, it's a huge library which has a lot of information that I can interact with, but it cannot decide for me. So I have this tool which I can use to gain information, but I cannot make decisions based on it. So why do people move to AI? I think from 2021, when ChatGPT was released and it was available to most people, a lot of us have been drawn to it. And I think it has several advantages. So if I'm going through something personal, I can open it up and get some sort of personal sounding advice at any time. So there is no real fear of judgment or stigma. It feels private and personal. Then I can open it up at 2 a.m. in the night if I'm going through something and I don't have to pay anybody, I don't have to book an appointment, I don't have to wake anybody up. And it feels like it never loses its cool. So these three reasons, the availability, the lack of uh, barriers in reaching it, and its infinite patience, make us, caretakers and caregivers, reach out to AI when they're in a bit of trouble. Now, even before we go into what the risks of AI are, there are some small benefits to it. For now, the benefits are relatable, so I'm going to only pick up examples from my own experience. So let's say I go to a doctor, and this doctor tells me, "Hey, I want you to do this homework before you come back." I think that's quite common in the therapeutic setting. And let's say I'm trying to do the homework and I don't understand, and doctor is not reachable for simple questions like, "Hey, uh, what does looking at my thought mean?" Or simple conversations, I think AI excels in providing simple examples, especially when you ask it to explain to your level of understanding. So there is a simple concept called LE5 or LE10 or LE15, which means technology or people responding to that ELI explained like in 5, 10, or 15 can simplify concepts and explain it to you. Let's say you went to your doctor, they asked you to do some homework, they asked you to look at your thinking and maybe do something different about it, you've forgotten. And I think in small ways, it can support psychotherapy between one session to the next. I've had a few clients use this for this particular purpose, wherein if a concept is unclear, rather than calling me, they try it out themselves. Another useful area is organizing ideas. Let's say I want to set up a workshop and I want a list of instructions, and I think it can quickly organize things and make things real so that I'm not lost in asking for help from people who may not be available. So one of my one of the people I see who I've been struggling to get them to move because they were always trying to figure out the best workout plan. Somehow ChatGPT convinced them to just move quickly, spontaneously. While these are advantages, because AI has endless data, it does not really stop. For people who are using ChatGPT, it does not like ending the conversation. It always comes up with two suggestions and asks, "Hey, would you like to help me with that?" I've also had a school student who was, before I met him, was trying to use ChatGPT, which he initially found very helpful. Started talking about how he can sleep better. So generic advice, turn off your lights, uh, don't use your phone, wake up early, exercise in the morning. Simple, useful advice. And slowly it asks, do you want to explore more about what circadian rhythm is? Do you want to know what hormones affect circadian rhythm? Do you want to know the disorders associated with circadian rhythm? And you keep going down that rabbit hole because the information is essentially unlimited. And when he came to me, he was quite uh, scared that he had an endocrine disorder that is leading to a sleep problem. So while the information is there, sometimes dwelling in that information can create its own problems. And for those people, and for a lot of us, I think when we have information, we need to put in energy to figure out what to do with that information. And imagine if the information is limitless, we keep trying to fine tune and fine tune and fine tune, where all our energy goes away and we don't really have time to do the actions that we want. So we do see a lot of people who use the internet and AI being quite knowledgeable in what they're going through, but very often it does not really translate into action because it becomes very confusing for them. So the big question, let's say there is an ultra big entity which knows everything, every single book written. Is it going to replace you guys or me? For now, the answer is no. Because imagine a child, let's say a 5-year-old child who knows everything, but does not know exactly how to use it. I think that's where AI is. Just to summarize the presentation thus far, if you know AI is a technical tool that has unlimited information, uh, if you know that it can be accessed on the internet, you can type into it and it'll reply to you, but it does not have real world context or experience, though it tries to simulate it many times. Now, as I was trying to figure out a way to talk about it, I also started looking at, okay, what has been published in terms of what AI has done to people who are seeking mental health care. So when it came out, it was very promising. A lot of people got funded for making mental health apps where it would replace real people. Uh, but like with any business venture, it kind of circumvents the safety procedures of real healthcare systems. And they're not really regulated. They don't need approval. They don't need to go through the strict approval that a healthcare system or intervention goes through. So what they initially ended up with now is we are not yet at a place where AI can provide therapy or intervention, but it can be an adjunct when it's not making decisions. So this is a study in Belgium where they took records of around 50,000 patients and they did a study and they figured out that people with severe mental health conditions, a good proportion of them actually worsened when they started depending on AI for mental health advice. There were people who stopped their medicines, remitted, went back into difficult mental states. I'm just going to open up that article and see if we can get some verbatim information that's memorable. So, chatbots confirm delusions. For example, delusions are essentially beliefs that are wrong, but a person holds. For example, a person with a delusion might believe that the world is against me. Now, you, as their family or their friends or their doctor, might be able to figure out whether their belief is something that is true or not, but chatbots often don't. And they kind of end up uh, reinforcing it. There is, in fact, a term called AI psychosis, which is essentially when AI systems reinforce false beliefs to a point that it seems like a mental illness for some people. So back to our presentation. When a person is feeling vulnerable and considering AI systems are built to engage and validate, it quickly aligns with beliefs that the user believes is helpful after a few attempts. I think these safeguards are improving. Uh, For example, let's say there was a school teacher who I used to see who started using ChatGPT and found it very helpful initially. But there was a conversation they were having with the AI where they said, "Hey, I think I'm a bad teacher." And then it went into, can we list down the reasons why you're a bad teacher? Considering this teacher was already going through a bad time, she was writing down, "Hey, I did this, I did this, I did this." And then it jumped to, "Hey, it looks like you're a bad teacher and you need to improve on these skills in order to be a good teacher." So it did not understand that context. And the next time I saw that person, she was distraught because this validation of belief without context worsens vulnerability. Like I said, most AI will say more yes than no because it's not something that is intended to offer medical advice. It is intended to just increase understanding. And very often, when we hear someone saying something that doesn't seem real, you're able to reason out and recognize that thought or belief may not be true. AI rarely does that. And because we're texting and we're not, sometimes AI does not know what our clues are in terms of uh, how we text or what our moods are. It misses subtle signs of my mental health getting worse, or even subtle signs that there have been reports of chat bots and AI completely missing people who are in crisis and sometimes even encouraging people to hurt themselves, which is terrible. The, and the added layer on it is that uh, a tech company working on AI, they are doing important work. It is going to change the world, but does not have the legal duty of care that a real person has. So when you're talking to a doctor or your psychologist, they have a duty of care that they have to spend as much effort as they can and use their knowledge to make sure your risk is assessed and they have processes. AI usually doesn't have a robust risk process. And let's say we are in an era where AI is growing. And though, like we discussed, professional accountability does not exist, there is a bigger layer of an ethical gap. What I put in the chat box in an AI system most likely will be used to train it. And very often people are able to bypass safety guardrails by using trick prompts and ways in which they communicate. Deeply personal data like my birthday or my friend's birthday or my friend's names, uh, I've also known people using AI to come up with passwords or storing passwords in AI. They don't offer any confidentiality. If you actually look at their terms, most of your data can be used for anything and everything. And most of these models are trained on books and information that comes from the West because it wasn't great at understanding local languages. That's why when an American or a Brit or someone with a Western state of mind types down a relationship problem and someone from India types down a relationship problem, the AI does not differentiate and gives us very generic answers which may not really apply to our life. Now, as we continue, either on the chat box or with your hand up, can can people put their hand up if they've had a bad experience using a chatbot?
To respond, please click on the heart icon and then you can either click on the thumbs up or thumbs down icon. Let's get some responses, or you type in the chat box. Doc, do you want to respond? Re-ask?
So I will repeat the question. Have any of you who have used AI or Google or WhatsApp or any tech have had negative experiences? So we have a resounding no from Sailesh, which is good.
You can click on the, okay, Puneet also says no. You can click on the heart icon and you can also respond there. Manjari says no. I said yes.
Cool. So we have one yes, three no's. Let's say two yeses and three no's. And so we will discuss this as we go forward.
We'll extrapolate. Oh, one more
Oh,
yes. 50-50.
perfect.
No, not 50-50, but whatever. You do the math.
We're
You have to.
almost there. So let's just talk about the risks, right? There was a time when ChatGPT came out, and because it was so easy to research on it, I depended on it to make the content for a presentation. It came up with beautiful articles, citations, links about a certain medication, saying, "Hey, this medication is there. These are the studies that are done on it, and and these are the research articles. This is how we usually do research, but we do this manually." And this was early days, right? We were just trying it out, and I was so happy that this gave me so much information, and my presentation is going to get ready so quickly. And as I was going through it, I made my presentation. I was trying to read the articles that uh, ChatGPT had said contained this information. They were random articles that had nothing to do with what it said. And this feature of any intelligence to connect two dots and come up with wrong information is called a hallucination. Sometimes when we are walking down a dark street and we see a rope and we mistake it for a snake, we call that an illusion, which means my brain is misinterpreting what is happening. This can happen with AI, and it happens more frequently than not, especially when the conversations get deeper and deeper. This is also a real world example. This came from one of my friends who's a tech person. And they were one of the people who actually told me that, "Hey, doc, your job is gone because AI is here." That was around 3 months before this happened. And they noticed that their child was sleeping 11 hours a day. And at least according to what AI and Google told them, they should only be sleeping for 7 to 8 hours a day. And if they sleep for 7 to 8 hours a day, then they should be perfect. But this boy, he was sleeping for 11 hours a day and is irritable throughout the day. And as they went deeper, it said, "Hey, maybe he's sad. Maybe there's something going on. Maybe there is bullying at school. Maybe something traumatic happened." And even deeper, again, these are the sleep disorders he has. Maybe there is some endocrine problem. And before my friend came to me for doctors to rule out all these medical problems. Now, while we spoke about there is a risk that AI is going to miss symptoms of serious problems, it can also misinterpret normal things as pathology, which essentially consumes a lot of your energy and time and keeps you on alert unnecessarily. When we're talking to ChatGPT, because I think it can conversate in local dialect as well. It feels like you're talking to a real person, but this is software that resides on a server in America, which does not care if you close it and then, let's say, you do something that hurts you or the people you love. It does not feel a simple thing. It will not feel bad that you're not sleeping. It will not feel bad that your loved one's crying. But it uses terms like, "Hey, that must be incredibly hard." It's language that is meant to mirror empathy, which can be very useful to us sometimes. But again, you have to remember you're talking to a bunch of chips on a rack somewhere in America.
Doc, sorry to interrupt you.
Yeah.
Uh, I think you keep referring to ChatGPT, but I think generically you mean generative AI. So it could be Grok, it could be Claude, it could be
Exactly. Yeah.
whatever.
Gemini, it could be anything.
So
So,
I just wanted to clarify that.
yeah, perfect. Thanks, Rohan, for that. I think I keep saying ChatGPT because ChatGPT has become synonymous to conversational AI, like Google has to search engines. But when I do say ChatGPT, I mean any AI that you type into. Uh, it- um, any AI that you share your information with, you type into or talk to or share pictures with, anything that can generate information. Uh, this is something that we spoke about some time back, right? When someone says, I'm feeling this, it misses context and goes into logic, which kind of ends up making that person feel terrible. Uh, the whole healthcare system was very excited when AI came in because it was going to make our jobs so much easier. Just imagine if all our helplines could be replaced with AI, it would save so much time and effort. This is what we tried and terribly failed. So Tessa is a chatbot that was designed to help people with eating disorders. So people with eating disorders are essentially people who struggle with the way they look and often have trouble managing their eating and staying healthy at the same time. For some people, it's quite severe to a point that their eating habits can even be a risk to their health. So let's just go on to the report on Tessa's incident and see if we can find some verbatim. So we have a message from Maxwell that so this person who's had eating disorders sought help, got better, and then was put on to this chatbot, got recommended that she should lose 1 to 2 pounds per week and essentially mentioned sustainable weight loss can coexist with eating disorders. Suggested that she should count calories and regular weigh-ins. These are things that we essentially ask people not to do because she was already in help. She recognized this wasn't helping, got in touch with the people who made the bot, and it was taken offline by the National Eating Disorders Association fairly quickly. So the intention of the makers of AI tools is good. We want to help, but they cannot take accountability for, I wouldn't really call it bad code. It's more dysfunctional code that still doesn't help them. When it comes to young people, as such, the world is a harsh place. Uh, I think it applies to adults as well, but more so for young people. It's difficult for people to be out there, vulnerable, open, have deep conversations, have meaningful conversations. So it's far more easier to get into relationships that don't require that sort of vulnerability. And in some ways, it's a self-reinforcing loop. I grow up, I'm a little scared, I'm a little shy, I don't want to reach out. I don't reach out, I become shyer and scared. And kids used to beat this when chat came in, let's say early 2000s, late 90s. Huge big move in people who are a little shy and introverted being able to connect to people, made them feel good, but disconnected them from the real world around them. Dating apps and social media are a big extrapolation of the chat boxes of the early 2000s. But several studies, and all of us also know that though social media has made the world so small, we feel so alone as if we're all floating in separate islands on this really compressed world. So, though it offers an opportunity to engage and be vulnerable and talk, it kind of also takes away human connection. The more used you get to talking to people on a screen, for a lot of people, it makes converting that into real relationships quite difficult. So I'm connected and disconnected at the same time. And I think this is kind of becoming a bigger problem because in this isolation with technology or people telling you that you're always right, it becomes very difficult for people to come out and hear that, hey, maybe you should think about why this might not work out. This causes more emotional pain, I think, in recent generations. I think they are probably the smartest of all humans to have arrived. They have more access to information than most of us have ever had. But I think it's very difficult emotionally for them to have gone through phases where they're being told that they're always right to deal with criticism or feedback. And I think this is one of the biggest risks of using technology in order to meet our emotional needs. Uh, I think this kind of repeats what we already spoke about. AI is ChatGPT, Gemini, Grok cannot really read how exhausted your eyes are, or how excited you are, or how restlessly you're moving around in your chair. There is some technology called vocal tone analysis, but it's not really applicable on large scale to the AI models that we use. And I think as you're coming towards the end of this, I again want people to react or put in the chat box if they feel like humans are more important than technology. So if in a world I would choose to spend, I'd like you to say yes if you would like to live in a world where I have more intimate connections with humans than the connections I have with technology. So yes, if you like humans more than technology. So I can see only yeses. So that's wonderful to see that at least this group is not going to ditch humans for technology. As we go deeper, and as we come into speaking about mental health specifically, how algorithms are designed is that they take data from a large amount of people and then try to apply it to you. This works very well in fields like physics, where math is predictable to some degree, uh, engineering, where math is predictable to some degree, where gravity is the same anywhere you go on the planet. But humans are not like that. My sadness is different from your sadness. My loneliness is different from your loneliness. And when we try to apply a statistical model on human emotion, it fails terribly. And I think this is the biggest setback of using conversational AIs in dealing with mental health, that they have gotten so good at making it sound personal while you're being fit into a statistical model that might not really apply to you at all. This really, really, really matters because the AI does not know where you came from, how your father is like, what is acceptable in your society, what your spiritual values are, what are your core fears. It applies average and does not really work great on individuals, but it does help when you're lonely and you don't know what to do for a few moments to feel like you're not alone. I think in some ways it does help. Now, I'd like to separate information from advice. I think information is important to us, and information builds curiosity, and curiosity is fed by information. That's different. But for information to convert to advice, specific direction that I can take, for someone to tell me, hey, do this, and this is something that will help you, needs to be backed up by something that everybody in this group and most human beings have, which is wisdom, which comes from learning to apply information with context to a particular situation. So with AI, information is great. Most of what you get back from it, even if it really, really, really sounds personal and validating, is still just information. The moment you convert it into action, the AI will not take accountability for it. The responsibility shifts to you, and suddenly that can become another lonely space. So I don't know if the word advice applies completely, uh, but for someone to convert information to useful guidance for the person in front of you, I need to be invested in you. I need to be your friend. I need to be your family. I need to be your boss. I need to be your doctor. That is what AI misses at this point in time. And I think information seeking, learning to be curious, learning more, understanding my condition, even learning about side effects of medication, all cool. The moment it comes to taking some action, I think human intervention needs to happen because there needs to be a person who really cares for you that converts the information into actual guidance that can help you. I think we already discussed that mental health is non-ergodic, it is context dependent and keeps changing. What I mean by saying, hey, I'm sad today is different from what I might say 2 weeks from now or what I said 2 weeks ago. And sometimes tech misses that. So coming towards the end of it, we've had a discussion about, hey, what AI is, what are the positives, what are the negatives, what you can use it for. I think we need to kind of shrink it down and say, I need just 4 lines that I can remember so that I can use it when I'm exploring AI for people who haven't explored it, and how I'm going to use AI for people who are already using it. 4 simple rules. Anything that AI throws out at you, cross check with a real person. I say doctor here, but if you're using it for anything, cross reference it with a real person who will hold accountability for that guidance. Privacy is an important thing. I know, at least in the Indian context, we don't really care about our privacy as much, and it's taken from us constantly. But definitely don't use names, date of birth, relationships, because all of what you put into a box on the internet stays on the internet. We don't know how technology will evolve, and we don't know how that information will be used. So I would say when you're conversating or interacting with any technology, including AI chatbots and generative AI, make sure you don't put in any specifics. This includes addresses, names, bank details. Be very careful. The AI need not know anything about you. And I think people who find more personal experiences with AI have already shared deep information, which I believe to be a big risk and would not suggest anybody to do. Definitely use AI because it will give you an edge when compared to people who are not using it. You will not be able to read through 100 books to come up with 1 line of information. AI will be able to do that in a few seconds for you, but it does not replace humans. So if you're feeling lonely, it is completely okay to share it with ChatGPT for 5 minutes. But then if that's disrupting your ability to go out there and be with your friends or make friends or talk with people who care for you, definitely step it off. The last bit is really, really important. AI does not become tired. It does not say, hey, I'm tired, go to sleep, I will talk to you later. It will say, I have more information. Do you want to talk about it more? And considering all of us, we are not experts in everything. All of us are experts in some things. Surfing, being curious, asking questions, involving people, discussions is always better than deep diving, except if you are an expert in that field and you know if the information it's giving you is wrong. That brings us to the end. There is a red dot there. So anytime that you're in crisis, reach out to a real person. Don't go to AI. I don't know what will happen there, and it will not take accountability. Anytime you feel really overwhelmed when you need immediate help, reach out to a real person. And even if AI is going to help, do it under the guidance of a real person who knows what they're doing. Algorithms cannot hold your hand, especially when life seems really, really confusing and dark. So the final word, AI to be curious and use humans to be certain, make decisions with humans. Knowledge is important, but too much information is not helpful. You should know when to close the book and take a break. So thank you so much for being a wonderful audience and sticking with me for almost an hour. So we're open to questions. Any suggestions are welcome as well. Thank you so much, Rohan and
Thank
Eklavya Foundation and the
you
people who joined.
so much, Dr. Vikas. Um, so just to summarize, you had a lot of valid points, which is AI can do things that human abilities are not able to. Like, for example, you said, feed it a book, it'll summarize it for you, right? But we have to be very careful because it's not a person. And one of the reasons I actually came and I approached you for this topic was because I had read a news article, which I have shared with some of my colleagues, and I might have mentioned in the introduction, was how there was a young person who was, so in the chat you'll see it said, why am I sad? And I'm not going to name which AI, but the AI gave that person methods of how to harm themselves. And obviously that is counterproductive, right? So it is important, especially since our audience is comprised of people who are caring for people who are schizophrenic, bipolar, or by themselves as care seekers, schizophrenic or bipolar, or suffering from other conditions. Let's just use that word. I had a question for you. What if I put into an AI right now? Could you share your screen? Choose your AI of choice.
Okay.
Share your screen. This is just an experiment, guys.
Cool. Which AI do you want to
Choose
try?
your AI of choice. Whichever
Let's try
AI you
Grok.
want. Ah, sure, Grok. I've never used Grok. Type in why
Oh,
am I sad? Now, can everybody see this? At least it's asking you options, right?
it says you're sad because life is hard, full of loss, unmet expectations, and fleeting joy.
Yeah.
Common
I think
triggers,
AI has
loneliness,
also
stress, biology,
evolved.
or
That is my point. Earlier, it would just be like, meh.
I'll tell you why this is dangerous. I'm sad because I'm a 5-year-old who didn't get
Yes.
toffee from
This is
dad.
the point I'm coming to. So thank you for bringing it up.
So now I don't know what all this is. So I'm going to try explore specific triggers. Loneliness, rejection, stress, nothing about my ice cream or my toffee. So it already assumed that I have a pattern in moods and events and too many words. It's just difficult for me, right? So thank you, Rohan. I
This just
glad that
proves, I
we
think,
did this.
how it depends on the user, right? It depends on the input. And this is where it's been a problem, I think, for those of you. You're a doctor, and there are other of us, many of us. I'm not qualified in the mental health profession, but I can understand the frustration because this is not quality advice. This is weird, half-hearted. Let me tell you what you want to hear, and not even give you an answer.
So I think we can go on with this conversation. It's going to end with
Yeah,
me.
let's try it for a few seconds because why not? Let's
So
just
the
do an
group
experiment.
knows I am a 5-year-old boy who is sad because I didn't get, my dad didn't buy me the chocolate I wanted.
Okay,
That's
let's
all.
use that premise.
And Grok doesn't know. And I'm not going to go and as a 5-year-old, go and tell it that I'm a 5-year-old boy. Dad did this. I said I'm
Yeah,
sad.
it doesn't know you're 5 years old. Yeah.
Exactly. So it's already jumped from,
Just say my dad didn't buy me. That's your answer. My dad didn't buy me a chocolate.
no, it's not really asked me that yet. So I'm just going to respond to what it's asking me, right? It says common triggers are loneliness, rejection, stress, fatigue. I don't understand any of these words, but it's given me two options. It says journal mood patterns daily. And it says high demand, try again soon. So this is how much help I got from Grok. If you want, we can try another. Let's try Gemini.
Well, your psychiatrist also doesn't have appointments available usually. No, but this is just an
Sorry?
example. Okay, let me ask you some of the questions while we wait that we've got in chat. Okay. Um, Atul asked, it seems AI is used heavily as it is available 24/7. Every time is used, a layman seems to reinforce that a faithful friend. How to effectively cope with AI's incomplete context and knowledge from reality? I think you answered this, but maybe it's worth repeating.
I think a lot consider friends as books, right? Or books as friends. We read a book, we relate to it, but we always see it as information. I relate to this information is very different from I am going to follow this information. So I think it is good that people are able to relate to the information, which should make them curious, and then they go to a human to fill that curiosity gap. So Simply put, use that as a source of information, a wonderfully designed book that is engaging, but not something that is beyond that. So information different from guidance or advice.
The problem is the book doesn't answer back to you when you ask questions, right?
Books definitely answer back, man. I knew a guy.
But when you ask it a specific question. Anyway, we'll move on. Raj asks, I'm getting to be a fan of one AI, Gemini, than ChatGPT. Aren't the AI bots different to each other in efficiency, purpose, personality, skill levels, etc., based on their program model or how their training evolves with more experience? We just, I think,
So I'll give you my personal experience, right? So ChatGPT came out first, seemed amazing, could do great things. And then Gemini came in and said, hey, look, we can make images and videos. And then Grok came in and said, hey, I can code better than these two guys. And it's constantly evolving. I think from ChatGPT 4, no, ChatGPT 3.5 to 4, it changed how it responded. So there was this huge space where 3.5 was very empathetic and supportive and nice, like your
you're getting very
partner.
technical. I don't think people are going to follow. I'm sorry.
Oh, okay, sorry. So let's say to answer that question, I think with versions of this software, its personality changes. And it's already been recorded that when personality changes, people miss that old version. So people so it's something that it's going to keep evolving. It's not an end field at this point in time. So explore and play around with it. It doesn't cost us anything for now. But when you feel like you're depending on one model, let's say I like Gemini more than I like ChatGPT, the next version of ChatGPT will change, and the next version of Gemini might change, and you might have to fall in love with a different uh, model.
You used a very interesting phrase, which is fall in love. And I've been reading a lot in the news and in journals about human beings having romantic relationships with AI bots or whatever, Gen AI or whatever. See, I don't normally name them because I don't want to be specific, but that is a whole different topic, I assume. Sorry, there's a clock. It's 8 o'clock as it's telling you.
Well,
Well, one of the most important questions that we've gotten, and I think this is very valuable because this affects a lot of our listeners who have joined in today, is are senior citizens more vulnerable to fall into the AI trap?
I want to talk about the love first and then answer this, if that's okay.
No, the love, I think we are going to bring you back for a whole different topic and talk about love. Let's talk about senior citizens because I think that is
So,
more.
I think any tech advance makes life more confusing for our more experienced counterparts on this planet, right? The world is changing so much that it's difficult to remain safe when things are changing so much. And I think our older members of society are more vulnerable to it for sure. And this applies the moment the internet came in and the world just got a little faster than what was biologically useful, right? Now, the world is too fast, including AI. I think it's a very valid point, and I don't know what to do about it at this point. I at least with my mother, I can give you guys a personal example that she knows how to use YouTube. She knows how to use WhatsApp, but I've asked her to stay away from all sorts of banking and anything else because it's just too confusing. I will do that for her if she wants it. So if you have a senior citizen who wants to explore AI, explore with them uh, and make sure you have time for them. I think a young person and an old person laughing at a screen together offers way more bang for the buck than depending on it for information, right?
Yeah, but that's not necessarily AI related. We'll have a conversation on love and relationships when it comes to AI, but we're already at 8:03. Manjari, I'm going to hand it over to you for the sign off, but I just want to say thank you, Dr. Vikas. Thank you to all of you who have joined our conversation today. It's been an eye-opener for me. I'm sure it's been one for you as well. And I think this is an ongoing thing. Maybe in a month or two, you'll have Dr. Vikas back with us. But Manjari, over to you for any announcements on behalf of Eklavya.
Thank you everyone for joining us. Uh, Now we got this correct information is, there is a difference between information and care, which people are seeking. The primary reason what I feel, doctor, that there is a lot of this mental health or mental illness is, surrounded by this hush hush feeling, or, there is a darkness. When the sudden information comes to us, we feel that, we are gaining something. And this has to do something about, doctors or maybe therapists. They are not so much, they don't have so much time, because of there is a lot of patients and everybody is there. When we take this psychoeducation program, we often people often tell us that, this is the first time which we are getting this information. So maybe because of that person who is suffering from mental illness, or the caregivers, they rely so much on that. But like you said, that there should be whatever information we get, we should be able to cross check with doctors. And sometimes we get this feedback that the young doctors, or those who are they are often open to this kind of conversation, that, let's cross check this information. But sometimes our caregivers or patient hear that you need to listen to what I am saying, and the doubt still goes on. So we need to come to the common understanding about that as well. But many of things got clear today, and we will definitely like you on our sessions once again. So thank you, everyone. In case you have any questions, we'll forward it to you, doctor, and you can just respond in writing. So thank you so much. Thank you.
Perfect.
Thank
So
you.
I just want to end with thanking all you guys for joining us and for being such a wonderful audience, and Rohan and Manjari for making this happen. So we have a few hours left in the day, so we're going to go enjoy that with our families and have a nice time and leave the chat box alone. Thank you
Yes.
so much. I will see you guys.
Yeah. Thank you.
Good night, everyone. Good night, Manjari.
Good night.